Bismillahirrahmanirrahim. Assalamu alaikum. In the last lecture, we studied drug interaction, role of pharmacists regarding drug interaction, and different mechanisms of drug interaction, where we studied pharmaceutical drug interaction and pharmacokinetic drug interaction. And under the pharmacokinetic drug interaction, we studied absorption drug interaction. And in this class, we will see different other mechanisms which are involved in drug interaction. So come towards interaction altering distribution. Interactions that affect distribution of the drug are highly bound to plasma protein, which are being displaced by another drug that bind more away. What basically occurs? This is plasma protein albumin, and here are two drugs. So the drug A competes the drug B to bind with albumin. So the free availability of the drug is responsible to produce its toxic effect. Take few examples. When anticoagulant drug is taken with phenylbutazone basically displaces anticoagulant to bind with protein, and there will be free availability of anticoagulant, which is responsible to cause increased clotting time, or the toxicity of anticoagulant drug will be exhibited. Similarly, tolbutamide is displaced by sulfonamide and representing its increased hypoglycemic effect. Now, the third mechanism of pharmacokinetic interaction is metabolism interaction. Drugs are metabolized by liver enzyme cytochrome P450, and there can be induction or inhibition of such enzyme, which ultimately affect the metabolism of concomitantly used drugs. For example, if a drug decrease the rate of metabolism of a drug due to inhibition of the enzyme, so there will be more availability of the drug to produce the toxicity. Like ciprofloxacin, which is inhibitor of enzyme responsible for metabolism of theophylline, that includes cytochrome 1A2 and cytochrome 3A4, due to which decreased metabolism of theophylline is resulted and showing its toxicity, which may include scissors. Now, the enzyme induction may be occurred by enzyme inducer drugs like rifampin when taken with oral contraceptive. So there will be increased metabolism of oral contraceptive, which result failure of oral contraceptive response. Now, the fourth mechanism of drug interaction of pharmacokinetic parameters include excretion interaction. It can be of two types, like one is changing in the active tubular excretion, which is associated with pH change, which result in altered excretion of drug. So the acidic drug like cephalosporin, acyclovir, penicillin, when taken with sodium citrate, which is responsible to increase the pH. So there will be increased excretion of acidic drug, which require acidic medium for the excretion. But in case of sodium citrate, which is causing increased renal pH, so there will be increased excretion of such drug, and their effect will be reduced because of decreased tubular reabsorption and increased excretion. On the other hand, if the basic drugs are taken with same drug like amloride and ranitidine, when taken with sodium citrate, so increased pH is favorable for basic drug to be reabsorbed, or there will be decreased excretion of such basic drug, which may induce their toxicity due to reduced excretion of such drugs. Now, there can be changes in the renal blood flow, which also a mechanism of excretion drug interaction, like NSAID, non-steroidal anti-inflammatory drug, causing decreased prostaglandins required for renal blood flow. So there will be decreased renal blood flow, and so the drug which is taken with NSAID, their concentration, their plasma concentration will be increased, which may produce its toxicity. Now come towards pharmacodynamic interaction. Pharmacodynamic means the response of drug, what the medication do and how to do. These include mechanisms and effects of medications to the body. We can say that it is the modification of action of one drug at the site or at the target site by the action of another drug, and it is independent of change in the concentration. It can be of different types: synergism, additive effect, and antagonism. When we talk about synergism, it is basically in such case, what happened? The net effect of the drugs is greater than the sum of individual effects of the drug. When the therapeutic or toxic effect of two drugs are greater than the sum of effects of individual drug, that we can say that it is 1 plus 1 is greater than 2. For example, combination of sulfamethoxazole when taken with trimethoprim, so there will be synergism of antimicrobial effect of these two drugs, sulfamethoxazole and trimethoprim. In case of additive effect, the net effect of two drugs is equal to the sum of individual effects. So we can say that it is the condition of 1 plus 1 is equal to 2. Such as when the thiazide diuretic and beta adrenergic blockers are used for their antihypertensive drug. So there will be additive effect of antihypertensive effect of these two drugs. Antagonism. In case of antagonism, the effect of one drug is inhibited by another drug, such as reduction of antihypertensive effect of thiazide diuretic when taken with non-steroidal anti-inflammatory drug, which is basically reduce its diuretic effect. So ultimately, reduce their anti-hypertensive effect, and it is basically attributed to the inhibition of prostaglandin responsible for renal blood flow, which is causing reduced renal blood flow and thus leads towards reduced diuretic effect and reduced anti-hypertensive effect. This all about These were all about the mechanism of interaction. Now come towards the classification of different type of drug interaction. So we can classify the drug interaction on the basis of their precipitants or the condition which are responsible for such drug interaction production or induction of such drug interaction. That can be of different types include drug-drug interaction, drug-food interaction, drug-herb interaction, drug-disease interaction, drug-allergy interaction, and drug-gene interaction. So first of all, we will see drug-drug interaction. In such case, drug is basically interacting with another drug and interfere with another drug, which ultimately result in alteration of effects of one or both drugs and may cause any unexpected side effect. And we can say that the effect can be of different type, such as decrease in the action of drug or drugs, increase in the action of drug or drugs, both drugs, and it may be incident of adverse drug effect, whether newer or new. Take few examples of drug-drug interaction like aspirin and warfarin. When taken together, they produce synergism of their effects and there will be increased risk of bleeding. Another example, which is somewhat beneficial effect of synergism, amoxicillin and clavonic acid, and there will be increased antibiotic effect. When H2 blocker and proton pump inhibitor are taken together, there will be increased pH of stomach. Thiazide diuretics and NSAID, when they are taken together, as we have already discussed, so there will be reduction in antihypertensive effect by the use of non-steroidal anti-inflammatory drug under the influence of reduction of prostaglandin responsible for renal blood flow. Similarly, another example showing the drug-drug interaction, rifampicin, when taken with oral contraceptive, there will be failure of oral contraceptives because of induction of the enzyme and increased metabolism of such enzyme required for oral contraceptives, and this induction is attributed to rifampicin, which is enzyme inducer. As earlier we said, there is not only drug which is responsible for drug interaction, but food can also interfere the way the drug produces its effect in the body. What basically occurred? A drug and food interaction happens when the food we take affect the ingredients of medicine and the drug may not produce its effect in a way it should. So we also have some examples to understand how such interaction occur. Benzodiazepine, when taken with grapefruit juice, there will be inhibition of enzyme by grapefruit juice required for benzodiazepine metabolism. So there will be increased availability of such drug, so the toxicity chances will be increased. In case of acetaminophen and alcohol interaction, there will be liver damage because both have their toxic effect on liver. Another example include interaction of monoamino oxidase inhibitors with tyramine-rich diet. Tyramine basically induces the norepinephrine, which causes increased blood pressure, and that tyramine required for its metabolism monoamino oxidase. But when the monoamino oxidase inhibitors are taken, which is antidepressive drug, in such case, the metabolism of tyramine is inhibited. So increased level of tyramine will be responsible for hypertensive crisis. Tetracycline, an drug when taken with dairy product or milk containing product or any food, when tetracycline is taken with any type of food which is having calcium or other metals, like dairy products which having calcium, so this calcium basically form chelation with chelate with tetracycline, and this chelate is basically insoluble and is not absorbed from GI, and there will be reduced absorption of tetracycline. Similarly, another interaction of include warfarin and vitamin K. Vitamin K rich food when taken with warfarin, so the effect of warfarin will be reduced because warfarin is anticoagulant drug and vitamin K is coagulating factor, so it affects the efficacy of warfarin. Naproxen, which is NSAID when taken with fatty food, is cause upset of stomach. Orange juice plus antacid containing aluminium. This juice is responsible to increase the absorption of aluminium and thus lead to severe constipation. These were all about were a few examples of drug-food interaction. Now come towards herb-drug interaction. Herb can also interact with drug to produce or to affect their efficacy by different mechanisms. We can take a few examples of drug-herb interaction. Cinnamon, which is most common domestic herb. When it's taken with anti-diabetic drug, there will be increased hypoglycemic effect. Capsicum, which is also a common kitchen herb, when it is taken with iron, so moderately it reduces the absorption of dietary iron, and it is also capable of increasing the absorption of theophylline, and such increases its incident of side effect. Garlic, which is most commonly anti-hypertensive herb, when taken with AC inhibitor, so there will be chances of hypotension. And when it is taken with anti-platelet drug, there will be increased risk of bleeding. Licorice root, when taken with antihypertensive drug, so this reduces the effect of antihypertensive drug. Senna, which is natural laxative, it produces risk of hypokalemia. with the potassium depleting diuretic, and thus excessive that it may be due to excessive loss of potassium, and there will be severely loss of potassium when the cyanide is taken for a long time with potassium depleting diuretics. You can see when taken with anti-diabetic drug, there will be increased risk of hypoglycemia due to synergism effect. St. John wort is responsible to decrease plasma level of antidepressant drugs like alprazolam and amitriptyline. Another type of drug interaction is drug disease interaction. So the disease condition can be worsened or exacerbates when a drug is taken with it, and it is responsible for such worsening and exacerbated conditions, such as nasal decongestant when taken in hypertension. So there will be increased chances of blood pressure or increased blood pressure. Non-steroidal anti-inflammatory drug, when taken in asthmatic conditions, there will be airway obstruction. Nicotine, when taken in hypertension, increased rate of heart will be resulted, or there will be tachycardia, which means the increased heart rate. And when metformin is taken in heart failure, there will be increased chances of lactate acidosis or lactic acid acidosis. Why? Because metformin causing lactic acidosis due to inhibition of gluconeogenesis, and it is due to inhibition of pyruvic acid carboxylase, and that's why lactic acid concentration is increased. And if the patient had heart failure, so this lactic acid not easily excreted out, so the chances of lactic acidosis is increased in heart failure. So it is contraindicated to use in heart failure because of lactic acidosis. Another term, which is drug-allergy interaction. It is commonly observed that one person does not show allergic response to a same drug, while another person may show allergic response to the same drug. So it may be due to any factor, but it is the immune response towards that drug, which is specific to some individual, which is allergic to some drug. So drug can also produce this interaction with allergic patient, such as some drug which has more chances to produce drug allergy interaction. Such drug include non-steroidal anti-inflammatory drug, antibiotics, chemotherapy drug, monoclonal antibodies, anti-seizures, and AC inhibitor. These are the drugs which are frequent causes of allergic drug interaction. So allergy can also cause drug interaction, but these are such interaction are specific to some individual which are allergic to such drug. Another type, drug gene interaction. Many patients do not adequately respond to a specific drug, but other may have good response. The efficacy rate of common medication are less than optimal. Certainly, the relationship between drug concentration and effect, that is called, it may called pharmacodynamics, is under the genetic influence. Why? Because the drug receptors are the product of gene. So uh, that's why some people do not adequately respond to same drug while the other have good response. So there is also another factor, that is a pharmacokinetic factor, like a drug gene interaction may occur when a patient genetic cytochrome P4 type, for example, cytochrome 2D6 is poor metabolizer of a specific drug, so the clearance of the drug is not proper. The influence of genetics on pharmacokinetic thus produce variability among individuals that may be the cause of treatment failure and its toxicity. So both pharmacodynamic and pharmacokinetic parameters are under the influence of gene. That's why the drug-gene interaction can also be occurred. Now, very importantly, how such interaction can be managed. Few points must be kept in the mind as a pharmacist. Comprehensive medication review. As we earlier discussed, in the risk factor, the multiple prescribers or multiple disease condition or multiple medication are the factor which are involved in drug interaction. So it is required to review the medication of patient to reduce the risk of drug interaction for patient well-being and to identify the potential drug interaction, to manage the consequences related to such interaction. Depending on the condition, continue, discontinue, or substitute the drug. If required, continuation, so continue the drug. If required, discontinue the drug to avoid the drug interaction, so discontinue the drug. Or if it can be substituted to reduce the drug interaction chances, so substitute that drug. And continuously monitor and follow can also be a strategy to manage the drug interaction. So exhibition of drug interaction can be tracked on time. Documentation. Document the effect or undesired effect if it resulted when the multiple drugs are taken together or taken simultaneously, or if the drug is taken with some herbs and some unwanted effects are exhibited, so note it down such effects. Communicate with patient and healthcare professionals. It is also a good strategy to communicate with other healthcare professionals related to patient and also with patient. It will help to tackle the situation and to detect the interaction, and it will be easy to manage the consequences of any drug interaction. This is all about drug interaction. Thank you so much. Allah Hafiz.